In 1987, tens of thousands of people gathered in Saudi Arabia for the annual Hajj pilgrimage. But what started out as a celebration led to a health crisis. Just a few days after the pilgrimage, more than 2,000 cases of meningitis broke out, spreading across Saudi Arabia and the rest of the world. The outbreak was so fierce that it was believed to have sparked a wave of deadly meningitis epidemics that ultimately infected tens of thousands of people worldwide.
Hello, this is me Rekha Sen on Swasthveksha. Today we are going over the meningitis. So, in the meningitis is inflammation of the meningeal layer of the brain and spinal cord. When covering meninges are failed to protect the brain and spinal cord, so let's get started. First thing we have to do is know the terminology related to meningitis and other inflammatory condition related to the brain. So, what is the meningitis? You know that inflammation of the meninges. It has two types, leptomeningitis and pachymeningitis. Leptomeningitis means infection of the pia and arachnoid matter because this two layer known as leptomeninges, and also between them the space contained which called subarachnoid space which contain a CSF. Why this has happened? Because when pia and arachnoid infected, between them the space is situated is subarachnoid space, so it's also get infected. Then other one is a pachymeningitis, in which infection of the dura mater occur due to the external injury, because dura is outer covering of brain and spinal cord. So this is about the meninges which contain a three layer. As you know about in detail, I already taken lectures over the meninges in my previous video. Link is available in the description. Then encephalitis means inflammation of the brain parenchyma. So when only meninges is involved, it's called meningitis. But when brain parenchyma is involved, no meninges, so it's called encephalitis. Okay. But what when the patient having a both meninges and brain parenchyma is infected or inflamed? What do you suggest this condition is? Let me tell you, meningoencephalitis, because it has a both condition, meningitis and encephalitis. Then cerebritis means localized inflammatory patches of the brain parenchyma, and it is not capsulated. As you can see, if this condition is not treated well, what will be happen the next? It can be leads to in the cerebral abscess. So what is a cerebral abscess? Cerebral abscess, which is also localized inflammatory but pus in the brain parenchyma, and it is one more thing is different from the cerebritis. It is capsulated. As you can see, this figure is having a necrosis, pus formation, glycoblast and glycosides occur, gliosis. So now you understand that what is the meningitis, encephalitis, cerebritis and cerebral abscess, which are the generalized and diffuse condition, meningitis and encephalitis, and which are the localized condition. Last two things we have been discussed, it is the cerebritis and cerebral abscess. So who is trigger the meningitis? Autoimmune disease and malignancy. The first one, it is what will be happen in the autoimmune disease, why it will be occur and why it will trigger the meningitis. Because body attacks own self, means our immune systems who are defense soldiers of our body, which turns out and kill the own body cell, infiltrate the pia and arachnoid and CSF area. Cell will be injured over there and produce a malignancy sometimes. Then there was reaction to the medication and chemicals. during intrathecal therapy directly injured into the CSF, and some drug produce inflammation like radiooptic substance like dye. Then infection, the most common cause it Neisseria meningitidis, it called meningococcal meningitis also, and other one is herpes simplex virus. Which route meningitis can be spread? One is a direct route through the trauma to the skull or spinal column injured. Pathogens enter into the meninges, then through the overlying skin, then going up through the nose, and also if anatomical defect were present, if congenital, so mostly is spina bifida, specifically meningomyelocele. For acquired defect is occur due to the skull fracture. Then another one is neighboring structure like paranasal sinus infection, otitis media, mastocytitis, tooth abscess, osteomyelitis. Then the other route is hematogenous route, in which pathogens are enter into the bloodstream, move through the endothelial cell of blood-borne barrier. No lymphatic system in the brain, specifically involve the pia mater because pia is most highly vascular layer. The arterial or through the venous supply, they can be entered. Through the arterial supply, specifically the person having a pneumonia, bronchiectasis, bacterial endocarditis, and in venous supply through the retrograde venous. How? I will tell you how it will be spread. When nose pinches, pus and microbes goes into the facial valve, then into deep vein, then goes into the tubernar sinus, and through the ophthalmic vein goes into the tubernar sinus. Then another route is retrograde peripheral route. Then herpes zoster and rabies in present. Then heterogenic route, in which are through the lumbar puncture. Then VP shunts who has a low grade recurrent chronic meningitis. Then Staphylococcus epidermidis. Okay, so these are the route where meningitis can be spread. Now, which are the type of meningitis? Bacterial meningitis, fungal meningitis, viral meningitis, tubercle meningitis, parasites meningitis, protozoal meningitis, and prions meningitis. So, according to the causing agent, it has a type of meningitis. Bacterial meningitis is known as a septic meningitis, and other types are also known as a aseptic meningitis. Bacterial meningitis is most common meningitis. So, bacterial meningitis cause different type of bacteria that we will discuss according to age of the person. But now another type, which is the viral meningitis, in which viruses are responsible to cause meningitis. The most common viruses are enterovirus, then herpes simplex virus, and HIV. In the herpes simplex virus, type 1, which is cause meningitis in adult, type 2 cause meningitis in children. Then Japanese encephalitis caused by the flavivirus, it is one category, and in the subcategory the virus is West Nile virus. It is transmitted by Culex mosquito. So remember this. Then less common viruses are causing the meningitis is mumps, varicella zoster, lymphocytic choriomeningitis. More and most common cause is enterovirus, and herpes simplex virus is causing more in adult than secondary in children. After that, in meningitis, which are the fungi is responsible? Cryptococcus genosis and coccidioides, both mainly affect in immunocompromised patient. In parasitic meningitis, parasites are Plasmodium falciparum. To treat this type, give only albendazole. After that, for protozoal meningitis, due to the amoeba in which transmitted or sprayed by nasal mucosal secretion during the swimming. Then, unique and important type, which is always asked in the most competitive exam, is prions meningitis. It is caused by infected protein by non-living things. Creutzfeldt-Jakob disease, Kuru, then fetal brain disease. Creutzfeldt-Jakob disease is extremely rare, but degenerative brain disorder leads to dementia and death. Most common signs and symptoms are myoclonic seizure, clinical investigation through the EEG. Then management is no treatment, but anti-seizure medication can be given. I am not going in detail right now, but if you want this prion in detail, comment the topic, so I will make the video in detail analysis. Now you know everything about the different types, so we're discussing the bacterial meningitis in much detail. So bacteria is responsible to cause meningitis in newborns. R, it is dangerous bell. For B for Streptococcus group B, E for E. coli, L for Listeria monocytogenes. So to remember, it is dangerous bell when the baby get birth. So let's discuss one by one. In the first is Streptococcus group B. It is a gram positive, include a Neisseria meningitidis, Neisseria pneumoniae and Neisseria sepsis. So how the newborns get this infection? From the mother. Yes, because it is present in the birth canal. So it can be preventive or not? Yes, it can be preventive. In the pregnancy at 35 to 37 week of gestation, take temperature and sensitivity, and if you find the streptococcus, give the penicillin injection to the mother. Also in the intrapartum period. Okay, now you get it? Then E for E. coli. Major defense in our body against the E. coli is IgM antibodies. But IgM cannot transfer to the placenta, but IgG can be transferred to the placenta. It is present in which is given by the mother, but it is gives some protection against E. coli. So when the baby can produce own self at their 1 month birthday. Okay, so that's the reason baby is because vulnerable, and because on this age can't produce IgM on self, get infected with the E. coli. So L for Listeria monocytogenes, it is also gram negative. Intracellular aerobic sand motile, few flagella create a tingling movement. It can attack in very old age, like older adult. Present in a birth canal. How mother get this infection? From unpasteurized milk and cheese, undercooked daily meats. Then it is rapidly colonized in colon, spread into the neighboring structure, vagina, and baby get infected through this. Then in infant, Haemophilus influenza previously is major cause in a poor countries and some nation, but now the vaccine is available called Haemophilus influenza B vaccine. Oh, you must be thinking that this is the virus. No, don't go to that name. It is a bacteria, and it is a gram-negative bacteria. Yes, and it is the most common causative agent to cause meningitis in children. Then, Streptococcus pneumoniae, also responsible to causing pneumonia. And remember, that is very important to know about this bacteria because it will be help you in different competitive exams. Why? Because it is the most common cause for bacterial meningitis. It is the most common cause for the bacterial meningitis. Okay. Then Neisseria meningitidis, also known as meningococcal meningitis, it is a most severe and dangerous type of meningitis. Yes, it is a most severe and dangerous type of meningitis. Why? Because it is spread through the droplet, respiratory or airway, when the person coughing or sneezing. So what will you do? Maintain the droplet isolation. It has a specific features, red or pink color rashes present on their skin due to the internal bleeding. It is the most commonly occur in adolescents and especially in adults who are living in a close quarters like hostels and quarters. It is a severe because person or patient die in hours or in a minute. Basically, signs and symptoms of severe meningitis are headache, drowsiness, patchy, fluctuation level of the consciousness. When receive the patient, also treat the patient with their close contact because it is spread through the droplet, respiratory or airway. Okay, so give the antibiotics orally or rapidly that kill the bacteria. In child, rifampicin and adult ciprofloxacin gives orally, so secreted in saliva and goes into the nasopharynx. So the Neisseria meningitidis is caused meningitis in age group 2 to 20 years of the person. In adult, Streptococcus pneumoniae are called pneumococcus. It is more occur in more than 20 years, specifically alcoholic person, then asplenic person. Asplenic means who had removed their spleen because spleen produce antibodies against it. And the person who had a history of basilar skull fracture, rhinorrhea and CSF is leaking. So what is the sign called? It is the halo sign, and I discussed in my previous lecture on traumatic brain injury. Now you are a master of bacterial meningitis because you know that if patient coming with the sign and symptoms of meningitis, you will very well to diagnose that it is occur by which bacteria, and you will save the life of patient. So don't keep up to you, but share to this knowledge to your colleagues so they will also can save the others patient's life. So share it and like this video, and if you not subscribe yet, what you are looking for it? Subscribe now. Okay, so how the bacteria will enter into the our system and what are the body give response to them. Entry of the bacteria in nasopharynx. The bacteria colonize and penetrate in nasopharyngeal mucosal membrane. So here we have our body's first defense mechanism, IgA antibodies. Streptococcus pneumoniae release enzyme called IgA protease which cut the IgA because it has a cutter and make them ineffective and defense is lost. Meningococcus, it has a fimbria stick with the mucosal cell on which moving cilia find a way to goes in. Then second stage is migration to the circulatory system, the private route or public route. So meningococcal goes to the private route. In private route, what will be happen? Meningococcal internalize in vacuoles and release in the blood. So the vacuoles, it is the type of burqa to hide the bacteria. So by this hidden private route enter into the blood system. Meningococcal is specifically occur in the adolescence. Then the public route, who will use this? Haemophilus influenza in younger baby, in which breakdown of the tight epithelial junction and enter into the our blood circulatory system. Now the bacteria moves into the our second defense mechanism, which is the blood. If they want to survive in the circulatory system, bacteria has to know that how to be safe from the neutrophils and the antibodies which cause phagocytosis. Bacteria have a specialized helmet which has a polysaccharide capsule, means anti-phagocytic materials which help the bacteria to protect from the antibodies and the complementary mediated phagocytosis. If they don't have this type of helmet, what will be happen with them? They will be rapidly eliminated from the circulation. After it, sooner or later in the CNS, through the migration from the blood to CSF, how they will migrate. It has a two way. One is choroid plexus and cerebral blood vessels. Choroid plexus is vascular bundle for the production of CSF. Then blood penetrate in the plexus, and here the endothelial cell, which is the second migration through the endothelial cell from the transcellular route, goes into the CSF. Other route from blood to cerebral blood vessels reach into the cerebral capillaries and bind with the cerebral endothelial cell. Through transcellular or intracellular route comes into the CSF. Now the bacteria comes in heaven. Here they can multiply as they want because here no defense mechanism and get relief. Bacteria have a free ride, goes to top of the brain and to the dural inner sinus and circulate rapidly in the CNS. Yet disease not started fully. Now bacteria shedding that toxins called endotoxins, and some undergoes lysis also release toxins. So some are the gram positive and some are the negative. Some gram positive have a teichoic acid and peptide glycan, don't have a lipopolysaccharide except Listeria monocytogenes, and the gram negative bacteria have lipopolysaccharides. Now challenging immune system. Now the real game is started. Fight between the immune system of meninges and the brain tissues. During fight, bacteria die, they release toxins, so we have to give immunosuppressors called steroids, and to kill bacteria gives to the antibiotics. That's why in the bacterial meningitis antibiotics will be gives with the steroids. So why this is happen? CSF don't have a defense system, but our brain have a microglia, astrocytes, monocyte, lymphocytes. They will reacting on the endotoxins which produce interleukin 1b, tumor necrotic factors, chemokines, excitatory neurotransmitter is glucoic acid, oxygen derivative free radicals, nitrogen reactase. All of these are act as a pre-inflammatory mediators. But system is angry now, but also have a beneficial effect. Number one is arterial dilation, because more defense in blood, so bring more blood into the CSF, means increase permeability of blood brain barriers. Then second thing is increase internal endothelial gap. Through this gap proteins which reach into the CSF, many of them complementary and antibodies into CSF. So that's the reason why protein increase in the CSF, which result cerebral edema, increase ICP and impaired circulation. So this is all about the pathogenesis of the bacteria. Stages of the pathogenesis which we have discussed in detail. The first stage is colonization in the nasopharyngeal area, then transmigration in the circulatory system, then it will be survive in the blood which have a special type of helmet, then transmigration from blood to CSF, and when they are in the CSF they will be multiply because there is a no defense mechanism here, then release toxins and cause the bacterial meningitis. Now the time for the summary. So we had discussed about what is the meningitis. It is the inflammation of the meningeal layer of the brain and spinal cord. Then different terms, which is the encephalitis, cerebritis and cerebral abscess. Then we had discussed what is the trigger factor to cause meningitis. It is autoimmune disease, then adverse reaction to the medication and the chemicals, and infections. After that we had discussed the root of the meningitis. So first it is a direct implantation, neighboring structures, hematogenous root and retrograde peripheral root, then etiogenic root. Then which are the types of the meningitis? Bacterial meningitis, fungal meningitis, viral meningitis, tubercle meningitis, protozoal meningitis and parasitic meningitis. Then specifically we had discussed the bacterial meningitis is causing in that specific age, and which are the bacteria is responsible to cause meningitis. Specifically the bacterial meningitis according to the age is newborn age, then infant and toddler, younger adult and older adult. Then pathogenesis of the meningitis, how the bacteria will be enter in the central nervous system. First they will colonize in the nasopharyngeal area, then transmigration to the circulatory system, which is the second defense mechanism, and there they have to survive in the blood, and from there they will transmigrate into the CSF area, and in the CSF there is no defense mechanism, so they can multiply in the CSF and release toxins over there and cause the meningitis in cerebral edema, increase ICP and cause signs and symptoms of the meningitis. So today we had discussed about the meningitis, Thanks for watching. For more videos, link in the description below. Don't forget to subscribe, and one more thing is, don't forget to watch the second part of the meningitis and share this video to your friends and colleagues.